is Lisa Allison. I'm an occupational therapist in the outpatient department at Lovelace UNM Rehab Hospital. I'm here today to talk to you about our wheelchair evaluation process and any information you need to know about sending your clients to our clinic. The first thing that we need is a wheelchair evaluation prescription. The prescription must say wheelchair evaluation, or we cannot schedule it appropriately. Once we receive that, we schedule the client for a 2-hour window. We have to have an assistive technology professional with us who is available to us to talk to us about different products and to help us with insurance questions. Once the client is here, we do an extensive evaluation that can take up to 2 hours. We do a complete history and physical. We talk about their environmental concerns and any needs that they need to meet their mobility requirements. We do a full evaluation of their range of motion, manual muscle testing, and strengthening and coordination and balance assessment. We also do a full extensive MAT evaluation that assesses their trunk stability and any deformities that they have. I'm going to do a quick demonstration on that before we talk about the rest of our wheelchair evaluation process. So our MAT evaluation consists of checking how someone's trunk alignment is. We make sure that they have an assessment of their pelvis, their spine, their shoulders, and any rotation that they have in their pelvis. So for example, if Janelle has some rotation and some obliquities in her pelvis, we would take that into consideration with the type of chair and cushion and backrest that she would qualify for her new seating system. The other thing that we do to ensure that the wheelchair is fit properly is we take measurements of the client. We take measurements of the femur, of the hips, shoulders, and the height of the trunk. Once the MAT evaluation is done and we determine what their diagnoses are and their needs, then we can discuss the type of wheelchair that is appropriate for them based on those diagnoses. We then allow the client to trial the wheelchairs. I brought a few wheelchairs here to give you some examples. So I brought some examples of types of wheelchairs we might recommend for our clients. Keep in mind the wheelchair that we recommend is based on the findings from our evaluation, not necessarily what is written in the order or what the client anticipates coming into the evaluation. This chair is a manual chair. It's a lightweight chair. The types of clients that would be appropriate for this are people with paraplegia or perhaps an amputee. There are different types of cushions and backrests that we can put on this chair depending on the type of diagnosis and the fitting that is needed to be done for that particular client. This chair is called a Group 2 power chair. This chair uses a battery to power the chair with a joystick. This has no any seat functions or leg elevation. It just simply drives with the joystick at different speeds. A client that might be appropriate for this is someone with chronic low back pain, with spinal stenosis, or COPD. This chair is a Group 3 power chair that has power seat functions as well as power drive. It can go into tilt, elevation, and leg elevation. We also can modify the cushion and backrest depending on the client's needs. A type of client that might be appropriate for this would be someone with MS, any kind of degenerative neurological disease, quadriplegia, and someone with extensive medical needs, perhaps lymphedema, things like that. So what we will do is we will take in consideration all of these chairs when evaluating your patient that you send over to our clinic. The reason why you would send one of your clients over here to us at Lovelace UNM Rehab Hospital is because we have an excellent rapport with our assistive technology professionals in the Albuquerque area. We have 2 therapists that can accommodate your scheduling of your patients, myself and Janelle Jackson, who's a physical therapist. We can generally get the clients scheduled within a month of the referral sent to us. Now, the other thing you need to know is once this evaluation is complete, we need information from the doctor's offices in order to complete the evaluation. We will send our findings to you. You will sign it and send it to the assistive technology professional company that we have designated in the wheelchair evaluation. That information must be completed and sent to the vendor in order to get the client the proper chair that's needed. We are available via email or phone if you have any questions on the process of this complex evaluation. I thank you for your time.